Hello, I am Dr. Amar Chauhan from World Medicine Hub, and today I will describe various salient features of our Moulaged patient. Because when we are using human volunteer, then security and safety of the volunteer is sometimes is a concern. So to overcome that, we have designed this is high fidelity low cost mannequin for low middle income countries, and I will describe its feature one by one. So if you switch on this button, then he has that audio signal that this patient is in altered sensorium. We are demonstrating a patient of polytrauma, and his breathing is not uh, okay. So here, like he is snoring, probably his tongue has fallen back, and now we will demonstrate on this Moulaged patient that how to do a jaw thrust. Now show us the jaw thrust. So when you do jaw thrust, then his breathing become regular, and then you can apply cervical collar, then you can do BVM. Okay, so this was, and you can do of course suction. So this was regarding airway. So the important thing is that he is giving you audio signal, so that something is wrong with him and something needs to be done, emergently. Now coming to B, so in B, now you can see the patient is breathing. So this is the very important feature this Moulaged patient had. The patient is breathing. Now if you want to run a scenario of pneumothorax or tension pneumothorax, then you can alter his breathing pattern, and now we will see that only the left side is rising. Now there is a little rise on the right side because now there is an abrasion on the right side, and in trauma we have to be biased. So if there is an abrasion and we try to palpate, then there are multiple fracture, and when you press it, then he cries. So indicating that there is underlying refracture, and with this, decreased rise, decreased breath sounds, and these distended way, you can create a scenario for tension pneumothorax. But of course, I know tension pneumothorax is a clinical diagnosis. But if you want to show them what will you see on the ultrasound, then this is our ultrasound simulator, and this is what you see on the screen. Absent lung sliding sign. So this is a case for tension pneumothorax versus pneumothorax. Okay, now so in this mannequin or Moulaged patient, you can do needle decompression also. So this is how it is done in case of tension pneumothorax, because you have to be very swift. So you can see the air bubble inside the syringe. So we have incorporated this facility because tension pneumothorax is a fatal condition and needs to be treated on emergent basis. Okay. Patient has got pneumothorax scenario also. Okay. So this was regarding B. So coming to the C, I will describe its feature according to ABCD protocol. Now in C, if you switch on the pulses on button, then it has got three pulses. It has got carotid, pulsation, it has got femoral, and it has got deep A also. Then to show the catastrophic hemorrhage, so it has got fracture of the thigh bone, and then you show how to apply cap tourniquet. So if we switch on this button, go to that side, so you will see there is a bleeding. So this is how, this is a catastrophic hemorrhage, you can demonstrate, and then stop it, and then you can apply. You can teach students how to apply a cap tourniquet. So this cap tourniquet is designed by us. Okay, that's it. So you fit the windlass in the column. Now if you want to run a scenario where patient is in shock and there is no peripheral vein available, then you go for IU access. So we have given IU access also. So tibial tuberosity, and then you go 1 to 2 centimeter or 1 to 2 finger. You get a giveaway feeling, and then you aspirate and you get so this is the IU access we have given, and then you can apply pelvic binder also. So we have given the see they show the greater trochanter, and this is the place where you should apply the pelvic binder. Okay, now coming to D, so this is how you will apply. Okay, now coming to D, that patient is in altered sensorium. Okay, so he is in altered sensorium because of the head injury, and you can see his left ventricle is dilated. So this was his D. Now coming to E, exposure. Do the dog roll. Come to this side. So this is the hidden injury. Okay, so that was about exposure. Now, if you want to run a stab injury scenario, then we can apply this knife. So you can run a chest stab injury scenario, and in this scenario, if you do ultrasound, then this is what you get on the ultrasound monitor. So if you want to go change over. So if you want to run a stab injury chest scenario and the patient comes with chest stab injury and hypotension, the first thing you have to do is put a probe, and this is what you get on the ultrasound simulator. This is a scenario for cardiac tamponade, and what you do, obviously, you, of course, these patients need OR resuscitation, but for temporize the situation, you can do a pericardiocentesis. So we have incorporated pericardiocentesis. Of course, this is a landmark-based pericardiocentesis, and whenever possible, ultrasound guided should be done. Okay, so this is how do you pericardiocentesis. So these are the various features of our Moulaged trauma buddy by World Medicine Hub India, and this can be used to taught ABCD protocol and multiple polytrauma scenario. Thanks for your time. See you next time.